Hello, good day. I'm Dr. Nishan Silva, presenting using Facebook as a platform for remote patient care to address rehabilitation needs in a resource-limited environment during a crisis. I'm presenting this for MedInfo 2021 on behalf of myself and my team, Ayodhya Karunaratne, Damit Rajkulatunga, Samita Jayalat, who are all physiotherapists. So when COVID-19 pandemic hit Sri Lanka, a developing country, back in the early part of 2020, just like the rest of the world, the country was taken by surprise. And just like all the other entities in the country, a certain rehabilitation center, the setting of the study was also greatly affected to continue its normal routines, normal duties. So, but unfortunately, like most settings in Sri Lanka, a digital platform was not available at this time to take over. However, the continuity of patient care, being a resource poor country, was even more important. So the purpose was of this study was to put together a system, rather a makeshift system, using low-cost resources and commonly available resources until a digital platform could be, a proper digital platform could be developed. So a group of experts in physiotherapy and in patient care, medical doctors, were put together as a panel, and a series of discussions using the Delphi technique was conducted to determine how best the routine patient care at the Impulse Rehab Center could be replicated on a low-cost platform. The first part of the discussion was the different low-cost platforms that could be used. And the best scenario was to use Facebook, the social media platform, because it's the most commonly used social media platform in Sri Lanka, and it's available on mobile devices, and which were quite a lot in Sri Lanka, and the very good mobile coverage, purely because of two factors: low-cost devices being available, and also high-speed network. Covered a fairly large part of the country, and definitely the area concerned was the Western Province, had a very good mobile coverage, and the team next task was to determine how the normal functions of the clinic could be replicated over a social media platform, and to do that they differentiated the normal functionalities into different segments. Segments which could be facilitated via the different functionalities available on the social media platform Facebook, and that we present as results. I'll start with communication. Now, the Facebook allows two-way communication via the Facebook chats. So that could be one-to-one, that could be one-to-many as groups. And in establishing this communication, we could also establish professional therapeutic relationships. In doing so, first a consent and a verification process would take place, where the patient verification could also be aided by other instruments like a mobile phone, a mobile text, or a mobile phone call, and also via email wherever that is possible. So and consent could be obtained by similar means, and also by social media platform itself once the account is verified as of the patient's genuine account. Could be the consent could be obtained via chat communication or audio message or a video recording. Now, clinical assessment was one other area that the group thought that could be replicated using the social media's functionalities. Now, one of the key things of using Facebook was the ability to share pictures, ability to share video and audio recordings, and ability to have real-time live calls or video calls. Now, for an example, a swollen joint could be shown to the therapist over the camera, or it could be a photograph of it could be taken and then passed over to the therapist. Patient education and group-based therapies. Now, patient education happens one-to-one or as in groups. Now, group-based therapies, such as, say, for an example, the group of patients who have undergone ACL reconstruction. The clinic used to run group classes for them for their later on rehab, as part of their later on rehab program. And also the group of osteoarthritis, knee joint osteoarthritis patients, or the group of back pain due to facet joint arthropathy patients. So likewise, the clinic used to run group-based rehabilitation sessions. So these groups could be replicated on Facebook as Facebook groups and on chat groups. So if it's a chat group, the group session for the week could be conducted by the therapist over the chat group. Material could be shared, feedback could be obtained. To a certain extent, the group members could communicate with each other and to motivate each other, which is part of the group dynamics expected in group-based rehabilitation. Patient education also could be done in the same or very similar manner, where the therapist could share the information via the group chat services. Monitoring and follow-up, for an example, like the improvement of range of movement of a joint. The patient could take pictures, the patient could do recordings and pass over to the therapist serially. And the therapist could send the recommended next level of exercises to the patient on their group, on their individual or group chat. So in conclusion, to a large extent, the Facebook could be used as a platform, as a makeshift platform to maintain some level of functionalities that the clinic needs to maintain in a crisis situation. Of course, until a proper digital health or an e-health platform and a telehealth solution is designed using the norms of the usual e-health platforms. So, and this is particularly useful as a low-cost method for developing countries and for resource-poor settings to be used in a crisis situation, and also as a temporary solution. And there were some challenges like patient verification and also obtaining the consent and the privacy and the safety of the information shared. And of course, a certain amount of compromise have to be made in a crisis situation in order to maintain the continuity of care. And we would be more than happy to accept any comments, questions on this project. Thank you.